Free CNA Practice Test 2026 Real Exam Questions and Answers. Question 1. What is orthostatic hypotension? Option A. High blood pressure when sitting. Option B. Feeling faint and dizzy when standing up suddenly. Option C. Rapid heart rate after exercise. Option D. A type of skin infection. The correct answer is option B. Feeling faint and dizzy when standing up suddenly. Moving residents slowly and allowing them to dangle prevents orthostatic hypotension. Question 2. What is apnea? Option A. Difficulty breathing while exercising. Option B. Lack or absence of breathing. Option C. Rapid and deep breathing. Option D. A type of severe cough. The correct answer is option B. Lack or absence of breathing. Apnea is common in sleep apnea and can occur during the dying process. Question 3. What is cyanosis? Option A. A yellow discoloration of the skin. Option B. A blue or gray discoloration of the skin. Option C. A red and itchy rash. Option D. A sudden loss of memory. The correct answer is option B. A blue or gray discoloration of the skin. Cyanosis indicates that the body's tissues are not receiving enough oxygen. Question 4. What is hyperventilation? Option A. Slow and shallow breathing. Option B. Rapid and deep breathing. Option C. Normal breathing at rest. Option D. Holding your breath for a long time. The correct answer is option B. Rapid and deep breathing. Hyperventilation is often caused by anxiety or pain and affects oxygen levels. Question 5. What is hypoventilation? Option A. Rapid and deep breathing. Option B. A slow and shallow breathing. Option C. The process of breathing out. Option D. Absence of breathing. The correct answer is option B. Slow and shallow breathing. Hypoventilation can lead to a dangerous buildup of carbon dioxide in the body. Question 6. What is hypoxia? Option A. When the body has too much oxygen. Option B. When cells do not have enough oxygen. Option C. The process of digestion. Option D. A type of blood clot. The correct answer is option B. When cells do not have enough oxygen. Hypoxia is a life-threatening condition that requires immediate oxygen therapy. Question 7. Chronic obstructive pulmonary disease typically involves which two disorders? Option A. Pneumonia and bronchitis. Option B. A chronic bronchitis and emphysema. Option C. Asthma and the common cold. Option D. Lung cancer and tuberculosis. The correct answer is option B. Chronic bronchitis and emphysema. Both disorders damage the airways and make it difficult for the person to breathe. Question 8. What should you use when giving mouth care to an unconscious resident? Option A. A standard toothbrush and paste. Option B. A soft toothette or sponge swab. Option C. A wet washcloth with soap. Option D. A piece of dry gauze. The correct answer is option B. A soft toothette or sponge swab. Toothettes are gentle and prevent the resident from accidentally biting a toothbrush. Question 9. What should you do when cleaning a resident's dentures in the sink? Option A. Hold them with both hands and no water. Option B. Place a hand towel in the sink or fill it with water. Option C. Use a strong metal scrub brush. Option D. Leave the drain open. The correct answer is option B. Place a hand towel in the sink or fill it with water. Patting the sink prevents the dentures from breaking if they are dropped. Question 10. What is the most serious physical risk for a resident in restraints? Option A. Feeling sad. Option B. A strangulation or death. Option C. Loss of appetite. Option D. Having messy hair. The correct answer is option B. Strangulation or death. Residents can become entangled in restraints, leading to severe injury or death. Question 11. A cataract is an eye disorder in which of the following occurs? Option A. The person becomes completely blind suddenly. Option B. The lens of the eye becomes cloudy. Option C. The person has too much pressure in the eye. Option D. The person sees bright flashes of light. The correct answer is option B. The lens of the eye becomes cloudy. Cataracts cause blurred vision and can usually be treated with surgery. Question 12. What does the term arthritis mean? Option A. A broken bone. Option B. The inflammation of the joints. Option C. A type of skin rash. Option D. The loss of muscle mass. The correct answer is option B. Inflammation of the joints. Arthritis causes pain, swelling, and stiffness in the affected joints. Question 13. What is geriatrics? Option A. The care of children. Option B. The care of aging people. Option C. The study of plants. Option D. The management of a facility. The correct answer is option B. The care of aging people. Geriatrics focuses on the unique health needs of the elderly population. Question 14. What is gerontology? Option A. The process of a wound healing. Option B. The study of the aging process. Option C. The study of heart disease. Option D. The process of human birth. The correct answer is option B. The study of the aging process. Gerontology includes the physical, mental, and social changes in people as they age. Question 15. Which professionals make up the primary nursing team? Option A. The doctor, surgeon, and pharmacist. Option B. The registered nurse, licensed practical nurse, and certified nursing assistant. Option C. The social worker, chaplain, and dietitian. Option D. The resident, family, and visitors. The correct answer is option B. The registered nurse, licensed practical nurse, and certified nursing assistant. The nursing team works together to provide direct daily care to the residents. Question 16. What is an invasion of privacy? Option A. Reporting a resident's fever to the nurse. Option B. Violating a person's right to keep their body and affairs private. Option C. Knocking on a resident's door before entering. Option D. Closing the curtain during a bath. The correct answer is option B. Violating a person's right to keep their body and affairs private. Protecting privacy is a legal and ethical requirement for all healthcare staff. Question 17. What does the acronym HIPAA stand for? Option A. Health Intake and Patient Assessment Act. Option B. Health Insurance Portability and Accountability Act. Option C. Powerly Informed Patient Activity Area. Option D. Hospital Information and Privacy Access Agency. The correct answer is option B. Health Insurance Portability and Accountability Act. This federal law protects the confidentiality and security of a person's health information. Question 18. What is a medical record? Option A. A resident's personal diary. Option B. A written or electronic account of a person's condition and response to care. Option C. A list of the resident's favorite foods. Option D. A document that belongs to the resident's family. The correct answer is option B. A written or electronic account of a person's condition and response to care. The medical record is a legal document used to coordinate care among the team. Question 19. In terms of documentation, what is objective data? Option A. Information that a person tells you. Option B. Information that is seen, heard, felt, or smelled. Option C. The opinions of the nursing assistant. Option D. A guess about a resident's health. The correct answer is option B. Information that is seen, heard, felt, or smelled. Objective data is also known as signs and can be measured or observed. Question 20. In terms of documentation, what is subjective data? Option A. Information you can see with your eyes. Option B. Information a person tells you that you cannot observe through your senses. Option C. The resident's pulse and blood pressure. Option D. The weight of the resident. The correct answer is option B. Information a person tells you that you cannot observe through your senses. Subjective data is also known as symptoms, such as the resident saying they have a headache. Question 21. How should you respond to a resident who exhibits demanding behavior? Option A. Ignore them until they are quiet. Option B. Treat them with dignity and try to understand the cause of the behavior. Option C. Tell them they are being rude. Option D. Report them to the police. The correct answer is option B. Treat them with dignity and try to understand the cause of the behavior. Patience and empathy are necessary to handle residents who may be frustrated or in pain. Question 22. What is self-centered behavior in a resident? Option A. Caring about the needs of others first. Option B. Behaving as if everything is about them and ignoring the needs of others. Option C. Being very quiet and withdrawn. Option D. Helping the staff with their duties. The correct answer is option B. Behaving as if everything is about them and ignoring the needs of others. This behavior is often a result of the resident's loss of control over their own life. Question 23. What does MSDS stand for in facility safety? Option A. A medical staff duty schedule. Option B. Material safety data sheet. Option C. A minimum standard for daily service. Option D. Manual safety device system. The correct answer is option B. Material safety data sheet. The material safety data sheet provides information on how to handle chemicals safely. Question 24. How should a stretcher be moved down a hallway? Option A. Pushed by one person head first. Option B. Pushed by two people with the resident's feet first. Option C. Pulled by one person from the side. Option D. Quickly so the resident doesn't get bored. The correct answer is option B. Pushed by two people with the resident's feet first. Two people are needed for safety, and moving feet first prevents the resident from becoming dizzy. Question 25. What is the leading cause of death among persons aged 65 and older? Option A. Infections. Option B. Falls. Option C. Heart attacks. Option D. Diabetes. The correct answer is option B. Falls. Falls often lead to fractures and a decline in overall health in the elderly. Question 26. When do most falls occur in long-term care facilities? Option A. During the morning shift change. Option B. During the night and after meals. Option C. During lunchtime. Option D. Only on the weekends. The correct answer is option B. During the night and after meals. Reduced lighting and increased confusion at night contribute to fall risks. Question 27. All of the following are common causes of falls except which one? Option A. Poor lighting and cluttered floors. Option B. Wet and slippery floors. Option C. Properly fitting non-skid shoes. Option D. Bathtubs and showers. The correct answer is option C. Properly fitting non-skid shoes. Safe footwear is a primary way to prevent falls, not cause them. Question 28. Is every resident in a nursing home permitted to use bed rails? Option A. Yes, everyone needs them for safety. Option B. No, they are only used if ordered and for specific medical needs. Option C. Only if the resident's family pays for them. Option D. Only at night. The correct answer is option B. No, they are only used if ordered and for specific medical needs. Bed rails can be dangerous and are considered a restraint in many situations. Question 29. Where are handrails typically located in a facility? Option A. In the bathroom. Option B. In the hallways. Option C. On the side of the bed. Option D. In the kitchen. The correct answer is option B. In the hallways. Handrails help residents maintain balance as they walk through the building. Question 30. Where are grab bars typically located in a facility? Option A. In the hallways. Option B. In the bathroom. Option C. On the resident's chair. Option D. In the elevator. The correct answer is option B. In the bathroom. Grab bars are used to help residents move safely on and off the toilet or in the shower. Question 31. When is the device called a transfer belt? Option A. When helping a person walk. Option B. When moving a person from one place to another, such as bed to chair. Option C. When the resident is sleeping. Option D. When used as a restraint. The correct answer is option B. When moving a person from one place to another, such as bed to chair. Transfer belts provide a secure place for the assistant to grip during a move. Question 32. When is the device called a gait belt? Option A. When helping a person walk or ambulate. Option B. When transferring a person into a bathtub. Option C. When the resident is in a wheelchair. Option D. When it is being washed. The correct answer is option A. When helping a person walk or ambulate. A gait belt helps the assistant support the resident's balance during walking. Question 33. What could be a serious consequence of a resident laying flat on their back for too long? Option A. Improved circulation. Option B. Pneumonia. Option C. Increased muscle strength. Option D. Better sleep. The correct answer is option B. Pneumonia. Immobility allows fluid to collect in the lungs, increasing the risk of infection. Question 34. What is the definition of a non-pathogen? Option A. A microbe that causes a severe infection. Option B. A microbe that does not cause infection and is often beneficial. Option C. A type of cleaning chemical. Option D. A person who is not sick. The correct answer is option B. A microbe that does not cause infection and is often beneficial. Many non-pathogens live on the skin and in the digestive tract to help the body. Question 35. What is sepsis? Option A. A minor cut on the finger. Option B. A systemic infection throughout the entire body. Option C. A type of skin ulcer. Option D. The process of a wound healing. The correct answer is option B. A systemic infection throughout the entire body. Sepsis is a medical emergency that can lead to organ failure and death. Question 36. What is the first link in the chain of infection? Option A. The portal of entry. Option B. The source or causative agent. Option C. The method of transmission. Option D. The susceptible host. The correct answer is option B. The source or causative agent. The infection starts with a pathogen, such as a bacteria or virus. Question 37. What is medical asepsis also known as? Option A. Sterile technique. Option B. Clean technique. Option C. Contamination. Option D. Disinfection. The correct answer is option B. Clean technique. Medical asepsis involves removing or destroying pathogens to prevent their spread. Question 38. What is the process of sterilization? Option A. Washing with regular soap. Option B. The total absence of all microbes, including spores. Option C. Using an alcohol-based hand rub. Option D. Cleaning a room with bleach. The correct answer is option B. The total absence of all microbes, including spores. Sterilization is used for instruments that enter the human body. Question 39. Which precaution should be used for a resident with the flu? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Standard precautions only. Option D. Contact precautions only. The correct answer is option B. Droplet precautions. Droplet precautions protect against pathogens spread through coughing and sneezing. Question 40. Which precaution is specifically used for a resident with tuberculosis? Option A. Contact precautions. Option B. Airborne precautions. Option C. Droplet precautions. Option D. No precautions are needed. The correct answer is option B. Airborne precautions. Airborne precautions require a special respirator mask and a negative pressure room. Question 41. Ergonomics is best defined as which of the following? Option A. The study of human behavior. Option B. The science of designing a job to fit the worker. Option C. The study of the aging process. Option D. A type of physical therapy. The correct answer is option B. The science of designing a job to fit the worker. Ergonomics helps prevent workplace injuries like back strain. Question 42. What is an exposure incident? Option A. When a resident is exposed to the cold. Option B. When a staff member is splattered by blood or has a needle stick. Option C. When a resident's privacy is violated. Option D. When a facility loses power. The correct answer is option B. When a staff member is splattered by blood or has a needle stick. Exposure incidents must be reported and followed by immediate medical evaluation. Question 43. Log rolling is a technique used to turn a person as a unit while maintaining what? Option A. Speed. Option B. Proper alignment of the spine. Option C. The resident's comfort only. Option D. The nursing assistant's height. The correct answer is option B. Proper alignment of the spine. Log rolling is used for residents with spinal or hip injuries. Question 44. What is the common saying used to remember how to position a resident with a pale face? Option A. If face is pale, raise the head. Option B. If face is pale, raise the tail or feet. Option C. If face is pale, call for help. Option D. If face is pale, give them water. The correct answer is option B. Face is pale, raise the tail or feet. Raising the feet helps increase blood flow to the brain when a person is pale. Question 45. What is the common saying used to remember how to position a resident with a red face? Option A. If face is red, raise the feet. Option B. If face is red, raise the head. Option C. If face is red, turn them over. Option D. If face is red, keep them flat. The correct answer is option B. Face is red, raise the head. Raising the head helps decrease pressure in the brain when a person is flushed. Question 46. What is entrapment? Option A. When a resident is locked in their room. Option B. When a person gets caught or entangled in spaces created by bed rails or mattresses. Option C. A type of mental health disorder. Option D. When a resident refuses to leave the facility. The correct answer is option B. When a person gets caught or entangled in spaces created by bed rails or mattresses. Entrapment can lead to serious injury or strangulation and must be prevented. Question 47. What information must be labeled on a resident's denture cup? Option A. The resident's age and weight. Option B. The resident's name, room number, and bed number. Option C. The date the dentures were purchased. Option D. The name of the resident's doctor. The correct answer is option B. The resident's name, room number, and bed number. Proper labeling prevents personal items from being lost or given to the wrong person. Question 48. What does it mean if a resident is diaphoretic? Option A. They are having a seizure. Option B. They are sweating heavily. Option C. They are unable to speak. Option D. They are extremely hungry. The correct answer is option B. They are sweating heavily. Diaphoresis can be a sign of pain, fever, or a medical emergency like a heart attack. Question 49. What does jaundice refer to? Option A. The skin turning blue. Option B. The skin turning yellow. Option C. A red and itchy rash. Option D. The loss of hair. The correct answer is option B. The skin turning yellow. Jaundice often indicates a problem with the liver or gallbladder. Question 50. Which areas are washed during a partial bath? Option A. The entire body from head to toe. Option B. The face, hands, underarms, back, buttocks, and perineal area. Option C. Only the arms and legs. Option D. Only the hair and nails. The correct answer is option B. The face, hands, underarms, back, buttocks, and perineal area. A partial bath focuses on the areas that develop odors or require frequent cleaning. Question 51. What is alopecia? Option A. Excessive body hair. Option B. The loss of hair or baldness. Option C. A type of skin infection. Option D. A condition that affects the nails. The correct answer is option B. the loss of hair or baldness. Alopecia can be caused by aging, medication, or medical conditions. Question 52. What is hirsutism? Option A. The loss of hair. Option B. The excessive body hair in unusual places. Option C. A type of severe dandruff. Option D. A condition where nails grow too fast. The correct answer is option B. Excessive body hair in unusual places. Hirsutism is often caused by hormonal changes in the body. Question 53. What is scabies? Option A. A common skin rash. Option B. A skin disorder caused by a female mite that burrows under the skin. Option C. A bacterial infection of the lungs. Option D. A type of allergic reaction to soap. The correct answer is option B. A skin disorder caused by a female mite that burrows under the skin. Scabies is highly contagious and requires specific medical treatment and isolation. Question 54. What is pediculosis? Option A. An infection of the feet. Option B. The medical term for a lice infestation. Option C. A type of skin ulcer. Option D. The loss of the sense of smell. The correct answer is option B. The medical term for a lice infestation. Lice can affect the head, body, or pubic area and spreads through direct contact. Question 55. When should a nursing assistant avoid using a safety razor on a resident? Option A. If the resident is using blood thinners or anticoagulants. Option B. If the resident has white hair. Option C. If the resident is sleeping. Option D. If the resident is very old. The correct answer is option A. If the resident is using blood thinners or anticoagulants. Blood thinners increase the risk of severe bleeding from even a small nick or cut. Question 56. How much water does an average adult need daily to maintain health? Option A. 500 milliliters. Option B. 1,500 milliliters. Option C. 5,000 milliliters. Option D. 1 gallon every hour. The correct answer is option B. 1,500 milliliters. Adequate hydration is necessary for all body systems to function properly. Question 57. How should you describe the location of food on a plate for a visually impaired resident? Option A. By pointing at the food. Option B. By using the numbers on a clock face. Option C. By telling them it all tastes good. Option D. By moving the plate around. The correct answer is option B. By using the numbers on a clock face. Telling a resident that meat is at 6 o'clock and peas are at 2 o'clock helps them eat independently. Question 58. How many pounds are in 1 kilogram? Option A. 1 pound. Option B. 2.2 pounds. Option C. 5 pounds. Option D. 10 pounds. The correct answer is option B. 2.2 pounds. Medical weights are often recorded in kilograms and must be converted accurately. Question 59. A resident is 4 feet tall. How many inches is this? Option A. 40 inches. Option B. 48 inches. Option C. 52 inches. Option D. 60 inches. The correct answer is option B. 48 inches. Multiplying 4 feet by 12 inches equals 48 inches. Question 60. A resident is 5 feet tall. How many inches is this? Option A. 50 inches. Option B. 60 inches. Option C. 70 inches. Option D. 80 inches. The correct answer is option B. 60 inches. Multiplying 5 feet by 12 inches equals 60 inches. Question 61. A resident is 6 feet tall. How many inches is this? Option A. 66 inches. Option B. 72 inches. Option C. 78 inches. Option D. 84 inches. The correct answer is option B. 72 inches. Multiplying 6 feet by 12 inches equals 72 inches. Question 62. When can a random urine sample be collected? Option A. Only in the morning. Option B. At any time during a 24-hour period. Option C. Only after the resident has eaten. Option D. Only once a week. The correct answer is option B. At any time during a 24-hour period. Random samples are used for basic screenings and do not require a specific time. Question 63. What is the clinical term for sugar in the urine? Option A. Hematuria. Option B. Glucosuria or glycosuria. Option C. Proteinuria. Option D. Pyuria. The correct answer is option B. Glucosuria or glycosuria. Sugar in the urine is a common finding in residents with uncontrolled diabetes. Question 64. What are reagent strips used for in urine testing? Option A. To measure the amount of urine output. Option B. To measure substances like sugar or ketones in the urine. Option C. To clean the specimen container. Option D. To filter out bacteria from the urine. The correct answer is option B. To measure substances like sugar or ketones in the urine. The strips change color when they react with specific chemicals in the urine. Question 65. When is the best time to collect a sputum specimen? Option A. Right before bedtime. Option B. First thing in the morning. Option C. Immediately after a meal. Option D. In the middle of the night. The correct answer is option B. First thing in the morning. Sputum is more concentrated and easier to expectorate after sleeping. Question 66. What is orthostatic hypotension? Option A. High blood pressure while lying down. Option B. A drop in blood pressure when the person stands up suddenly. Option C. A rapid heart rate during exercise. Option D. A type of lung infection. The correct answer is option B. A drop in blood pressure when the person stands up suddenly. Dangling the resident at the bedside helps prevent this condition. Question 67. What is aphasia? Option A. The loss of the ability to walk. Option B. The loss of the ability to speak or understand language. Option C. A type of severe skin rash. Option D. The inability to swallow food. The correct answer is option B. The loss of the ability to speak or understand language. Aphasia is common after a stroke or in advanced dementia. Question 68. What is acquired immunodeficiency syndrome caused by? Option A. A bacterial infection. Option B. The human immunodeficiency virus. Option C. Aging. Option D. Poor nutrition. The correct answer is option B. The human immunodeficiency virus. The human immunodeficiency virus attacks the body's immune system. Question 69. What is the final outcome of Alzheimer's disease? Option A. It is eventually cured with surgery. Option B. It always ends in death. Option C. The person regains their memory over time. Option D. It only affects the ability to walk. The correct answer is option B. It always ends in death. Alzheimer's is a progressive, terminal brain disease. Question 70. What happens to a person's level of consciousness during shock? Option A. They become very energetic. Option B. They may become confused or lose consciousness. Option C. They have no change in consciousness. Option D. They become very happy. The correct answer is option B. They may become confused or lose consciousness. Shock prevents the brain from receiving enough oxygenated blood. Question 71. In the FAST acronym for strokes, what does the letter F stand for? Option A. Fever. Option B. Facial drooping. Option C. Fainting. Option D. Feet. The correct answer is option B. Facial drooping. Checking if one side of the face sags is a key way to identify a stroke. Question 72. In the FAST acronym for strokes, what does the letter A stand for? Option A. Capitite. Option B. Arms and whether one will not raise. Option C. Aches and pains. Option D. Ambulating. The correct answer is option B. Arms and whether one will not raise. Weakness in one arm is a common sign of a cerebrovascular accident. Question 73. In the FAST acronym for strokes, what does the letter S stand for? Option A is sleeping. Option B is slurred language or speech. Option C, sweating. Option D is sensation. The correct answer is option B, slurred language or speech. Difficulty speaking or understanding others can indicate a brain injury from a stroke. Question 74. In the FAST acronym for strokes, what does the letter T stand for? Option A, temperature. Option B, time is of the essence. Option C, touch. Option D, taste. The correct answer is option B, time is of the essence. Rapid medical treatment is critical to minimize permanent brain damage from a stroke. Question 75. Where inside the lungs does the exchange of oxygen and carbon dioxide happen? Option A, the trachea. Option B, the alveoli. Option C, the bronchi. Option D, the pleura. The correct answer is option B, the alveoli. The alveoli are tiny air sacs where gases pass into and out of the blood. Question 76. Why is there a small hole at the bottom of an anti-embolism stocking? Option A, to make it easier to pull on. Option B, to check the circulation in the toes. Option C, to allow the resident to wiggle their toes. Option D, to save on material costs. The correct answer is option B, to check the circulation in the toes. The hole allows staff to see if the toes are warm and have a pink color. Question 77. Which nervous system is responsible for the fight or flight response? Option A, the parasympathetic nervous system. Option B, the sympathetic nervous system. Option C, the central nervous system. Option D, the digestive system. The correct answer is option B, the sympathetic nervous system. The sympathetic system increases heart rate and blood pressure during stress. Question 78. What is the term for black, dead tissue that may be found in a wound? Option A, a slough. Option B, eschar. Option C, serum. Option D, pus. The correct answer is option B, eschar. Eschar is thick and leathery and must be removed for a wound to heal. Question 79. What is a sepsis? Option A, a serious infection in the blood. Option B, being free of pathogens. Option C, the growth of bacteria. Option D, a type of medical equipment. The correct answer is option B, being free of pathogens. Aseptic techniques prevent the transfer of harmful microbes. Question 80. Where is the most common site for a pressure ulcer to develop? Option A, the ear. Option B, the sacrum. Option C, the knee. Option D, the elbow. The correct answer is option B, the sacrum. The sacrum bears significant weight when a resident is lying in bed. Question 81. What does it mean if a resident is sedentary? Option A, they are very active and walk a lot. Option B, they are barely moving or stay in one place. Option C, they are very talkative. Option D, they are extremely hungry. The correct answer is option B, they are barely moving or stay in one place. Sedentary lifestyles increase the risk of pressure sores and blood clots. Question 82. Where on a manual bed should a Foley drainage bag be hung? Option A, on the side rail. Option B, on the bed frame. Option C, on the footboard. Option D, on the headboard. The correct answer is option B, on the bed frame. Hanging the bag on the frame ensures it does not pull when rails are moved. Question 83. Separating a person from others against his or her will is an example of what? Option A, standard care. Option B, involuntary seclusion. Option C, proper isolation. Option D, restorative nursing. The correct answer is option B, involuntary seclusion. Involuntary seclusion is a form of abuse and is strictly prohibited. Question 84. What units is blood pressure measured in? Option A, milliliters. Option B, millimeters of mercury. Option C, degrees Fahrenheit. Option D, pounds and ounces. The correct answer is option B, millimeters of mercury. Blood pressure readings are recorded as a ratio of systolic over diastolic pressure. Question 85. How often should you check a resident's skin when they have a hot or cold pack applied? Option A, once per shift. Option B, every 5 minutes. Option C, every hour. Option D, only when the pack is removed. The correct answer is option B, every 5 minutes. Frequent checks prevent burns or tissue damage from extreme temperatures. Question 86. How often should physical restraints be removed to provide care? Option A, once a day. Option B, every 2 hours. Option C, every 4 hours. Option D, only if the resident asks. The correct answer is option B, every 2 hours. Removing restraints every 2 hours allows for movement, skin checks, and toileting. Question 87. What is a bland diet? Option A, a diet that is high in calories and fat. Option B, a diet with no spicy or irritating foods. Option C, a diet that consists only of liquid. Option D, a diet that is served very cold. The correct answer is option B, a diet with no spicy or irritating foods. Bland diets are used for residents with digestive issues or ulcers. Question 88. Which blood vessels always flow away from the heart? Option A, veins. Option B, arteries. Option C, capillaries. Option D, venules. The correct answer is option B, arteries. Arteries carry oxygenated blood to the tissues of the body. Question 89. Which blood vessels always flow back toward the heart? Option A, arteries. Option B, veins. Option C, arterioles. Option D, capillaries. The correct answer is option B, veins. Veins carry deoxygenated blood and waste products back to the heart. Question 90. What does the clinical abbreviation ABD stand for? Option A, abdomen. Option B, abduction. Option C, above bed device. Option D, absence of breathing. The correct answer is option A, abdomen. ABD is the standard medical abbreviation for the abdomen. Question 91. What does the abbreviation AC stand for in medical charting? Option A, after meals. Option B, before meals. Option C, at bedtime. Option D, as desired. The correct answer is option B, before meals. AC stands for anti-SIBOM, which means before meals. Question 92. What does the abbreviation ADL stand for? Option A, advanced daily living. Option B, activities of daily living. Option C, assisted daily living. Option D, average daily limits. The correct answer is option B, activities of daily living. Activities of daily living include basic self-care tasks like bathing, dressing, and eating. Question 93. What does the term ad lib mean when written in a residence care plan? Option A, as desired. Option B, at bedtime. Option C, after lunch. Option D, as tolerated. The correct answer is option A, as desired. Ad lib is short for ad libitum, meaning the resident can perform the activity as they wish. Question 94. What does the abbreviation AIDS stand for? Option A, acute immune deficiency syndrome. Option B, acquired immunodeficiency syndrome. Option C, acquired immune disease state. Option D, active immune deficiency symptoms. The correct answer is option B, acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome is a condition caused by the human immunodeficiency virus. Question 95. What does the abbreviation AKA stand for in surgical terms? Option A, also known as. Option B, above the knee amputation. Option C, acute kidney ailment. Option D, active knee alignment. The correct answer is option B, above the knee amputation. An above the knee amputation is a surgical procedure to remove the leg above the knee joint. Question 96. What does the abbreviation AM stand for? Option A, after meals. Option B, in the morning. Option C, as measured. Option D, after midnight. The correct answer is option B, in the morning. AM refers to the morning hours before noon. Question 97. What does the medical abbreviation AMB stand for? Option A, ambulance. Option B, ambulate or walk. Option C, ambidextrous. Option D, ambient temperature. The correct answer is option B, ambulate or walk. Ambulation is the clinical term for walking. Question 98. What does the abbreviation AMT stand for in documentation? Option A, amount. Option B, amputate. Option C, ambulate. Option D, ammonia. The correct answer is option A, amount. Amount is used to document the quantity of intake, output, or other measurements. Question 99. What does the abbreviation AP stand for in relation to a pulse? Option A, average pulse. Option B, apical. Option C, after meals. Option D, as prescribed. The correct answer is option B, apical. An apical pulse is taken by listening to the heart directly with a stethoscope. Question 100. What does the abbreviation BID stand for in medical timing? Option A, once a day. Option B, twice a day. Option C, 3 times a day. Option D, 4 times a day. The correct answer is option B, twice a day. The abbreviation comes from the Latin bis in die, meaning twice a day. Question 101. What does the abbreviation BE stand for in radiology? Option A, before eating. Option B, barium enema. Option C, bowel elimination. Option D, basic exam. The correct answer is option B, barium enema. A barium enema is an X-ray exam that can detect changes or abnormalities in the large intestine. Question 102. What does the abbreviation BKA stand for? Option A, below the knee amputation. Option B, bowel and kidney assessment. Option C, body keen awareness. Option D, basic knee adjustment. The correct answer is option A, below the knee amputation. A below the knee amputation is a surgical removal of the leg below the knee joint. Question 103. What does the abbreviation BM stand for? Option A, body mass. Option B, bowel movement. Option C, blood monitor. Option D, breathing method. The correct answer is option B, bowel movement. A bowel movement is the excretion of solid waste from the digestive tract. Question 104. What does the abbreviation BP stand for? Option A, body position. Option B, blood pressure. Option C, a breathing pattern. Option D, basic procedure. The correct answer is option B, blood pressure. Blood pressure is the force of blood pushing against the walls of the arteries. Question 105. What does the abbreviation BRP stand for? Option A, bed rest prescribed. Option B, a bathroom privileges. Option C, basic room protocol. Option D, a breathing rate pattern. The correct answer is option B, bathroom privileges. Bathroom privileges mean the resident is allowed to get out of bed to use the toilet. Question 106. What does the abbreviation C with a line over it stand for? Option A, with. Option B, without. Option C, clean. Option D, caution. The correct answer is option A, with. The symbol is derived from the Latin word cum, meaning with. Question 107. What does the abbreviation C stand for in temperature measurement? Option A, clean. Option B is centigrade or Celsius. Option C, caution. Option D, cold. The correct answer is option B, centigrade or Celsius. Celsius is a scale of temperature where water freezes at 0 degrees. Question 108. What does the abbreviation CA stand for in medical terms? Option A, cardiac arrest. Option B, cancer. Option C, calcium. Option D, clean area. The correct answer is option B, cancer. CA is a common clinical shorthand for cancer. Question 109. What does the abbreviation CABG stand for? Option A, cardiac area blood group. Option B, coronary artery bypass graft. Option C, common arterial blood group. Option D, coronary action blood gauge. The correct answer is option B, coronary artery bypass graft. A coronary artery bypass graft is a surgery that improves blood flow to the heart. Question 110. What does the abbreviation CAL stand for? Option A, calcium. Option B, calories. Option C, calculated. Option D, call light. The correct answer is option B, calories. Calories are a measure of the energy provided by food. Question 111. What does the abbreviation CATH stand for? Option A, catheter. Option B, cathedral. Option C, calculated. Option D, caution. The correct answer is option A, catheter. A catheter is a flexible tube used to drain fluid from or inject fluid into the body. Question 112. What does the abbreviation CBC stand for? Option A, complete bed care. Option B, complete blood count. Option C, common blood cells. Option D, cardiac blood count. The correct answer is option B, complete blood count. A complete blood count is a blood test used to evaluate overall health and detect disorders. Question 113. What does the abbreviation CBR stand for? Option A, a complete blood report. Option B, a complete bed rest. Option C, common body reflex. Option D, cardiac breath rate. The correct answer is option B, complete bed rest. Complete bed rest means the resident must stay in bed at all times. Question 114. What does the abbreviation CDC stand for? Option A is Centers for Disease Control and Prevention. Option B is Certified Disease Center. Option C, Common Disease Control. Option D, a Community Dental Care. The correct answer is option A, Centers for Disease Control and Prevention. The Centers for Disease Control and Prevention is the national public health agency of the United States. Question 115. What does the abbreviation CNA stand for? Option A is Certified Nursing Assistant. Option B, a Clinical Nursing Assistant. Option C, Common Nurse Aide. Option D is Certified Nurse Associate. The correct answer is option A, Certified Nursing Assistant. A certified nursing assistant provides basic care and assists residents with daily activities. Question 116. What does the abbreviation CO stand for? Option A, clean only. Option B, complains of. Option C, condition of. Option D, care of. The correct answer is option B, complains of. This is used to document a resident's subjective reports of pain or discomfort. Question 117. What does the abbreviation CPR stand for? Option A, Common Patient Recovery. Option B, Cardiopulmonary Resuscitation. Option C, Cardiac Pulse Rate. Option D, a Clinical Patient Report. The correct answer is option B, Cardiopulmonary Resuscitation. Cardiopulmonary resuscitation is an emergency procedure that combines chest compressions and rescue breathing. Question 118. What does the abbreviation CNS stand for? Option A, Common Nursing Staff. Option B is Central Nervous System. Option C, Clinical Nurse Supervisor. Option D, cardiac nerve system. The correct answer is option B, central nervous system. The central nervous system consists of the brain and the spinal cord. Question 119. What does the abbreviation CS stand for? Option A, common sense. Option B, a central service or central supply. Option C, clinical supervisor. Option D, cardiac surgery. The correct answer is option B, central service or central supply. Central supply is the department that provides medical and surgical supplies. Question 120. What does the abbreviation DOA stand for? Option A, date of admission. Option B, a debt on arrival. Option C, daily observation area. Option D, dietary order assigned. The correct answer is option B, dead on arrival. Dead on arrival means the person was deceased before reaching the facility or hospital. Question 121. What does the abbreviation DOE stand for? Option A, date of entry. Option B, dyspnea on exertion. Option C, daily oral exam. Option D, dietary output entry. The correct answer is option B, dyspnea on exertion. Dyspnea on exertion means difficulty breathing during physical activity. Question 122. What does the abbreviation DON stand for? Option A, daily observation note. Option B, director of nursing. Option C, Department of Nutrition. Option D, director of nutrition. The correct answer is option B, director of nursing. The director of nursing is the registered nurse in charge of the entire nursing department. Question 123. What does the abbreviation DRSG stand for? Option A, a dressing. Option B, dosage. Option C, a drainage. Option D, a driving. The correct answer is option A, dressing. A dressing is a protective covering applied to a wound. Question 124. What does the abbreviation DX stand for? Option A, daily exercise. Option B, diagnosis. Option C, dose. Option D, a drainage. The correct answer is option B, diagnosis. Diagnosis is the identification of a medical condition or disease. Question 125. What does the abbreviation ECG or EKG stand for? Option A, emergency cardiac group. Option B, electrocardiogram. Option C, electronic cardiac gauge. Option D, emergency kidney group. The correct answer is option B, electrocardiogram. An electrocardiogram is a test that records the electrical activity of the heart. Question 126. What does the abbreviation EEG stand for? Option A, emergency eye group. Option B, electroencephalogram. Option C, electronic ear gauge. Option D, emergency ear group. The correct answer is option B, electroencephalogram. An electroencephalogram is a test that records the electrical activity of the brain. Question 127. What does the abbreviation EENT stand for? Option A, emergency ear and nose team. Option B, eyes, ears, nose, and throat. Option C, external ear and nose treatment. Option D, emergency eye and nose treatment. The correct answer is option B, eyes, ears, nose, and throat. EENT refers to the specialized area of medicine covering those four parts of the head. Question 128. What does the abbreviation ER stand for? Option A, eating room. Option B, the emergency room. Option C, exam room. Option D, exercise room. The correct answer is option B, emergency room. The emergency room is the department of a hospital that provides immediate treatment. Question 129. What does the abbreviation F stand for in temperature? Option A, fluid. Option B, Fahrenheit. Option C, fast. Option D, feet. The correct answer is option B, Fahrenheit. Fahrenheit is a temperature scale where water freezes at 32 degrees. Question 130. What does the abbreviation FBS stand for? Option A, fluid balance sheet. Option B, fasting blood sugar. Option C, fast blood study. Option D, final body survey. The correct answer is option B, fasting blood sugar. Fasting blood sugar is a test that measures the amount of sugar in the blood after an overnight fast. Question 131. What does the abbreviation FL stand for? Option A, flashlight. Option B, fluid. Option C, final. Option D, floor. The correct answer is option B, fluid. Fluid refers to any liquid substance. Question 132. What does the abbreviation FX stand for? Option A, function. Option B, fracture. Option C, friction. Option D, fix. The correct answer is option B, fracture. Fracture is the medical term for a broken bone. Question 133. What does the abbreviation FUO stand for? Option A, final urine output. Option B, fever of unknown origin. Option C, fast urinary output. Option D, a frequent urinary output. The correct answer is option B, fever of unknown origin. This term is used when a resident has a fever but the cause is not yet identified. Question 134. What does the abbreviation GAL stand for? Option A, gallbladder. Option B, gallon. Option C, gauge. Option D, goal. The correct answer is option B, gallon. A gallon is a unit of liquid capacity equal to 4 quarts. Question 135. What does the abbreviation GB stand for? Option A, gastric bypass. Option B, gallbladder. Option C, goal balance. Option D, gauge board. The correct answer is option B, gallbladder. The gallbladder is a small organ that stores bile produced by the liver. Question 136. What does the abbreviation GI stand for? Option A, general intake. Option B, gastrointestinal. Option C, goal intake. Option D, gauge instrument. The correct answer is option B, gastrointestinal. The gastrointestinal system refers to the stomach and intestines. Question 137. What does the abbreviation GU stand for? Option A, general use. Option B, genitourinary. Option C, goal unit. Option D, gastric ulcer. The correct answer is option B, genitourinary. Genitourinary refers to the organs of the reproductive and urinary systems. Question 138. What does the abbreviation H or HR stand for? Option A, high. Option B, hour. Option C, head. Option D, health. The correct answer is option B, hour. Hour is a unit of time equal to 60 minutes. Question 139. What does the chemical abbreviation H2O stand for? Option A, hydrogen. Option B, water. Option C, heat. Option D, humidity. The correct answer is option B, water. H2O is the chemical symbol for water. Question 140. What does the abbreviation HIV stand for? Option A, health intake value. Option B, human immunodeficiency virus. Option C, high immune value. Option D, human infectious virus. The correct answer is option B, human immunodeficiency virus. Human immunodeficiency virus is the virus that causes AIDS. Question 141. What does the abbreviation HT stand for? Option A, heart. Option B, height. Option C, heat. Option D, high. The correct answer is option B, height. Height is the measurement of someone from head to foot. Question 142. What does the abbreviation HX stand for? Option A, height. Option B, history. Option C, heat. Option D, heart. The correct answer is option B, history. History refers to a resident's past medical events and conditions. Question 143. What does the abbreviation ICU stand for? Option A, Individual Care Unit. Option B, Intensive Care Unit. Option C, Internal Care Unit. Option D, Immediate Care Unit. The correct answer is option B, Intensive Care Unit. The intensive care unit provides specialized care for critically ill patients. Question 144. What does the abbreviation INO stand for? Option A, in and out. Option B, intake and output. Option C, internal and oral. Option D, confection and observation. The correct answer is option B, intake and output. Intake and output is the measurement of fluids consumed and excreted by a resident. Question 145. What does the abbreviation IV stand for? Option A, individual visit. Option B, intravenous. Option C, internal valve. Option D, involuntary. The correct answer is option B, intravenous. Intravenous means within a vein, often referring to fluids or medications given that way. Question 146. What does the abbreviation L stand for on a medical chart? Option A, large. Option B, left. Option C, liter. Option D, low. The correct answer is option B, left. This is used to denote the left side of the body or a specific limb. Question 147. What does the abbreviation lab stand for? Option A, label. Option B, laboratory. Option C, lower. Option D, lower. The correct answer is option B, laboratory. A laboratory is a place where medical tests are performed on specimens. Question 148. What does the abbreviation LB stand for? Option A, lower body. Option B, pound. Option C, lower. Option D, lab. The correct answer is option B, pound. The pound is a unit of weight equal to 16 ounces. Question 149. What does the abbreviation LIQ stand for? Option A, light. Option B, liquid. Option C, limited. Option D, lower. The correct answer is option B, liquid. Liquid refers to a fluid substance. Question 150. What does the abbreviation LLQ stand for? Option A, lower left quadrant. Option B, left lower quadrant. Option C, lower level quantity. Option D, left lower quantity. The correct answer is option B, left lower quadrant. The left lower quadrant is a specific area of the abdomen. Question 151. What does the abbreviation HA stand for in medical shorthand? Option A, heart attack. Option B, headache. Option C, health assessment. Option D, high anxiety. The correct answer is option B, headache. Headache is pain in any region of the head. Question 152. What does the abbreviation NV stand for? Option A, next visit. Option B, nausea and vomiting. Option C, normal value. Option D, nerve value. The correct answer is option B, nausea and vomiting. Nausea and vomiting are common gastrointestinal symptoms. Question 153. What does the abbreviation PX stand for in some shorthand? Option A, pounds. Option B, stomach pain. Option C, pulse. Option D, a position. The correct answer is option B, stomach pain. This shorthand is sometimes used to indicate abdominal or stomach pain. Question 154. How many cubic centimeters are in 1 ounce? Option A, 10 cubic centimeters. Option B, 30 cubic centimeters. Option C, 60 cubic centimeters. Option D, 100 cubic centimeters. The correct answer is option B, 30 cubic centimeters. 1 fluid ounce is equal to approximately 30 cubic centimeters or milliliters. Question 155. What does the abbreviation LOC stand for? Option A, left of center. Option B, level of consciousness. Option C, loss of contact. Option D, line of care. The correct answer is option B, level of consciousness. Level of consciousness is a measurement of a person's arousability and responsiveness. Question 156. What does the abbreviation LPN stand for? Option A, licensed patient nurse. Option B, licensed practical nurse. Option C, licensed professional nurse. Option D, local practical nurse. The correct answer is option B, licensed practical nurse. A licensed practical nurse provides basic medical care under the supervision of a registered nurse. Question 157. What does the abbreviation LT stand for? Option A, light. Option B, left. Option C, lower. Option D, long term. The correct answer is option B, left. This is a common shorthand for the left side. Question 158. What does the abbreviation LVN stand for? Option A, licensed vital nurse. Option B, licensed vocational nurse. Option C, licensed value nurse. Option D, local vocational nurse. The correct answer is option B, licensed vocational nurse. Licensed vocational nurse is the title used for an LPN in certain states like California and Texas. Question 159. What does the abbreviation LUQ stand for? Option A, lower upper quantity. Option B, left upper quadrant. Option C, level upper quadrant. Option D, light upper quadrant. The correct answer is option B, left upper quadrant. The left upper quadrant is a specific area of the abdomen. Question 160. What does the abbreviation MED stand for? Option A, medical. Option B, medications. Option C, medium. Option D, measure. The correct answer is option B, medications. Medications are drugs used to treat or prevent disease. Question 161. What does the abbreviation MID-NOC stand for? Option A, middle note. Option B, midnight. Option C, middle night. Option D, midnight observation. The correct answer is option B, midnight. Midnight refers to 12 o'clock at night. Question 162. What does the abbreviation MIN stand for? Option A, a minimum. Option B, minute. Option C, minor. Option D, measure. The correct answer is option B, minute. A minute is a unit of time equal to 60 seconds. Question 163. What does the abbreviation ml stand for? Option A, meter length. Option B, milliliter. Option C, milligram. Option D, monitor level. The correct answer is option B, milliliter. A milliliter is a metric unit of liquid volume. Question 164. What does the abbreviation NA stand for? Option A, not applicable. Option B, nursing assistant. Option C, normal action. Option D, normal assessment. The correct answer is option B, nursing assistant. A nursing assistant provides basic care to residents under the supervision of a nurse. Question 165. What does the abbreviation NEG stand for? Option A, neglect. Option B, negative. Option C, negotiate. Option D, negative. The correct answer is option B, negative. Negative indicates that a test result did not show the presence of a specific condition. Question 166. What does the abbreviation NOC stand for? Option A, notice. Option B, night. Option C, normal. Option D, no change. The correct answer is option B, night. The abbreviation comes from the Latin nacht, meaning at night. Question 167. What does the abbreviation NPO stand for? Option A. New patient only. Option B. Nothing by mouth. Option C. Normal pulse only. Option D. Nighttime position order. The correct answer is option B. Nothing by mouth. The abbreviation comes from the Latin nil per os, meaning nothing by mouth. Question 168. What is the chemical abbreviation for oxygen? Option A H. Option B O2. Option C a C. Option D N. The correct answer is option B, O2. O2 is the chemical symbol for oxygen gas. Question 169. What does the abbreviation OB stand for? Option A. Over bed. Option B. Obstetrics. Option C. Old body. Option D. Observation. The correct answer is option B. Obstetrics. Obstetrics is the branch of medicine dealing with pregnancy and childbirth. Question 170. What does the abbreviation OOB stand for? Option A. Only on bed. Option B. Out of bed. Option C. Observation of body. Option D. Only one body. The correct answer is option B. Out of bed. Out of bed indicates the resident is allowed to be upright or in a chair. Question 171. What does the abbreviation OR stand for? Option A. Oral. Option B. Operating room. Option C. Order. Option D. Observation room. The correct answer is option B. Operating room. The operating room is where surgical procedures are performed. Question 172. What does the abbreviation OS stand for in relation to anatomy? Option A. On side. Option B. Mouth. Option C. Open. Option D. Outside. The correct answer is option B. Mouth. OS is the Latin word for mouth. Question 173. What does the abbreviation OT stand for? Option A. Oral treatment. Option B. Occupational therapy. Option C. Overtime. Option D. Gold treatment. The correct answer is option B. Occupational therapy. Occupational therapy helps residents regain independence in daily activities. Question 174. What does the abbreviation OZ stand for? Option A. Ounce. Option B. Ozone. Option C. Order. Option D. Original. The correct answer is option A. Ounce. An ounce is a unit of weight or volume. Question 175. What does the abbreviation PC stand for in timing? Option A. Pre-care. Option B. After meals. Option C. A pulse count. Option D. Prior to care. The correct answer is option B. After meals. The abbreviation comes from the Latin post cibum, meaning after meals. Question 176. What does the abbreviation PCA stand for? Option A. Personal care assistant. Option B. Patient-controlled analgesia. Option C. Primary care associate. Option D. Professional care aide. The correct answer is option B. Patient-controlled analgesia. Patient-controlled analgesia is a method of pain control that allows the patient to self-administer medication. Question 177. What does the abbreviation PEDS stand for? Option A. Pedestrians. Option B. Pediatrics. Option C. Pedicures. Option D. Pedals. The correct answer is option B. Pediatrics. Pediatrics is the branch of medicine dealing with infants and children. Question 178. What does the abbreviation PER stand for? Option A. Prior. Option B. By or through. Option C. Percent. Option D. Period. The correct answer is option B. By or through. Per is used to indicate the method of administration, such as per OS for by mouth. Question 179. What does the abbreviation PM stand for? Option A, per month. Option B, afternoon. Option C, pre-medication. Option D, a pulse monitor. The correct answer is option B, afternoon. PM refers to the hours from noon until midnight. Question 180. What does the abbreviation PO stand for? Option A, a position. Option B, by mouth. Option C, postoperative. Option D, partial. The correct answer is option B, by mouth. The abbreviation comes from the Latin per os, meaning by mouth. Question 181. What does the abbreviation postop stand for? Option A, prior to. Option B, postoperative. Option C, position. Option D, postural. The correct answer is option B, postoperative. Postoperative refers to the period of time following a surgical procedure. Question 182. What does the abbreviation pre-op stand for? Option A, pressure. Option B, preoperative. Option C, prepare. Option D, prior. The correct answer is option B, preoperative. Preoperative refers to the period of time before a surgical procedure. Question 183. What does the abbreviation PrEP stand for? Option A, pressure. Option B, preparation. Option C, prior. Option D, preoperative. The correct answer is option B, preparation. Preparation refers to the steps taken to get a resident ready for a procedure. Question 184. What does the abbreviation PRN stand for? Option A, prior. Option B, when necessary. Option C, position. Option D, pressure. The correct answer is option B, when necessary. The abbreviation comes from the Latin pro re nata, meaning is needed. Question 185. What does the abbreviation PT stand for? Option A, point. Option B, patient. Option C, pulse time. Option D, partial. The correct answer is option B, patient. This is a common shorthand for a resident or person receiving care. Question 186. What does the abbreviation PT stand for? Option A, patient time. Option B, physical therapy. Option C, post-treatment. Option D, a pulse test. The correct answer is option B, physical therapy. Physical therapy helps residents improve their physical strength and mobility. Question 187. What does the abbreviation Q stand for? Option A, a quiet. Option B, every. Option C, quantity. Option D, quick. The correct answer is option B, every. The abbreviation comes from the Latin quisque, meaning every. Question 188. What does the abbreviation QH stand for? Option A, quick help. Option B, every hour. Option C, quiet hour. Option D, a quantity high. The correct answer is option B, every hour. The abbreviation comes from the Latin quaeque ora, meaning every hour. Question 189. What does the abbreviation Q2H or Q3H stand for? Option A, a quantity 2. Option B, every 2 hours or every 3 hours. Option C, quick twice. Option D, quiet twice. The correct answer is option B, every 2 hours or every 3 hours. This indicates how frequently a task should be repeated throughout the day. Question 190. What does the abbreviation QID stand for? Option A, once a day. Option B, 4 times a day. Option C, quick daily. Option D, equality. The correct answer is option B, 4 times a day. The abbreviation comes from the Latin quaterandi, meaning 4 times a day. Question 191. What does the abbreviation R stand for in temperature? Option A, right. Option B, rectal temperature. Option C, arrest. Option D. Respiration. The correct answer is option B. Rectal temperature. This indicates that a temperature was taken via the rectum.